Walawani, hello, and thank you for tuning in today for our Yarn Up, which is a COVID-19 Q&A. I'm Shani Wellington. I'm a proud Jerinja and Wandi Wandiyan woman from NITV, and I'd like to begin by acknowledging the traditional owners of the land we are on and pay respects to elders past and present, and I extend that acknowledgement to the lands wherever you may be tuning in from today. With us in the studio today is Dr. Jan Feazell, Senior Medical Advisor at New South Wales Health. And in Canberra, joining us on the video link is Dr. Jason Agostino, who is a medical advisor at NACCHO, which is the National Aboriginal Community Controlled Health Organisation. Now, thank you both for joining us to talk about the issues that are really facing mob at the moment and all the questions coming up when it comes to the COVID-19 vaccination. Now, I just wanted to start with a question for you, Jason. Now, all Aboriginal people 16 years and over are eligible for free COVID-19 vaccination. I know I've got my own already as well. Why do you think it's so important for us to get the jab?
Yeah, look, I think it's important for everyone to get the jab, but Aboriginal and Torres Strait Islander people in particular, because we know that COVID can make people more sick if they've got existing chronic conditions such as diabetes or heart disease. And unfortunately, a high number of Aboriginal and Torres Strait Islander people have these conditions, and they often start at an earlier age. And even if you don't have those conditions, it's likely that someone in your family does. So even if you're feeling well and don't have that, getting vaccine provides you with protection, but also decreases the chance that you're going to pass that on to family or community.
For sure. And it is about thinking about everyone around you as well as your own safety. And Dr. Jan, you've been answering questions on social media quite a lot and quite often, especially at this time. What are the concerns that you're hearing from people?
Look, I think there are things that people are worried about are things like, has the vaccine come too quickly? And what people don't realise is that all the vaccines have been based on decades of research. So it hasn't happened all that quickly. It's actually been many, many people working for many years who just turned their mind to COVID when it was time to do the COVID vaccine. I think people have also been confused by some of the safety messages about some of the vaccines. And it's a very different circumstance when you've got no COVID in your community. If you've got no COVID in your community, you don't want even a rare side effect to happen. But when you're like we are in Sydney, Western Sydney, southwestern Sydney, where you've got an epidemic going on, the game changes. You've got COVID in your community, it's spreading. And so we need to get people vaccinated quickly, because we know that the risks of getting COVID now are very high, and the risks of having a problem from that COVID are very high. And apart from staying home, the best thing we can do is to vaccinate people so that when they go out and do their work, which we know so many people need to do, when they have to go and do the shopping, because, we all need to eat, they're protected, and also they're helping protect their family from bringing it home from wherever they've needed to go with them.
And whatever your situation is at the moment, I'm sure lots of people do have some questions that are playing on their mind. And so today we are answering questions from, mob Aboriginal people all across New South Wales. And the first, in a video form question, comes in from Lexi. Let's take a look.
Why should I get the COVID-19 vaccine? Will the vaccination be made mandatory?
It's very, very straightforward. Will it be mandatory? And why should mob out there be getting it?
Look, the major reason why any of us should get it is it reduces our chance of needing hospital care. It reduces our chance of going into intensive care, and it reduces our chance of dying. So that's for me. That's what's in it for me. For what's in it for me as part of the community is I also protect the people I care about by, if I have even a very mild infection, because the vaccine you can still get a really mild infection after you have the vaccine, but you're far less likely to give it to anybody else. And so being able to protect each other is so important. And that's why it's really important that we get the vaccine. Is it mandatory? It may become mandatory, like some other vaccines are mandatory for healthcare workers in different settings. And that's the same with flu, for example. It's a disease that can impact the vulnerable people we care about. And so in certain settings, it may become mandatory, but everyone else, it's a choice. But at the moment, it's a choice we'd really encourage you to take.
And Jason, we're speaking about the importance for community, and we're speaking from the perspective of mob out there. For our Indigenous communities, why is it especially important for them to get the jab?
Yeah, so as we were saying about the high number of people that have chronic conditions like diabetes and kidney disease and are more likely to get severe COVID-19 that ends up in hospital, ICU or death, as Jan said. And the other thing is that unfortunately, many Aboriginal and Torres Strait people continue to live in crowded housing where there's many people under the one roof. So there's, if you don't have that protection from the vaccine, it's likely that you'll spread to your household members, and we want to avoid that at all costs.
Well, the next question we have is coming from Kylie in Tamworth. Let's take a look.
How do we know about the long-term side effects of these COVID vaccines?
Look, these are new vaccines, but the technology for the vaccines is not particularly new. We know how the vaccine's going to work in the body, and so the chances of long-term side effects, whilst we're monitoring them, are very unlikely to cause major problems for people. So we're watching the safety of these vaccines all the time. But what we do know are the long-term side effects of COVID. And we know that a lot of people who have even a mild infection with COVID can still be quite unwell some months later. And we know that people who've been in intensive care and needed help with their breathing, for example, that can have major impacts on them for many years onwards. So whatever those long-term effects of the vaccine, apart from giving you good protection from COVID long-term, far less likely to cause a problem than COVID.
Now we have a question coming from Aaron.
Hi, my name's Aaron. My dad's mob is Biripi from up Foster, Taree, Newcastle Way, and my mum's mob is Anawan from Armidale. Are there any barriers for mob getting the COVID-19 vaccine?
So look, the main barrier up until recently has been that to get the Pfizer vaccine, which is the vaccine recommended for people under the age of 60, it's only been available in these Pfizer hubs, which are mainly in cities and aren't with your normal clinic. But that's changed recently. So in the past 2 months, we've started bringing on more and more Aboriginal health services on board. And now we have over 100 clinics that are delivering Pfizer across the country, which is great. In addition to that, other general practices are also have Pfizer in there as well. So it's not a matter of going on to some place you're not familiar with and perhaps where you don't feel safe going to. For most people now, we can go to your regular GP or your regular Aboriginal health service and get the vaccine there.
And has that been kind of a focus, Jason, to make sure that that cultural safety is in place for mob?
Yeah, that's right. That's what we took it in. The approach we took with testing as well. We wanted to make sure that mob could get tested in the clinic where they receive their normal health care. And that has been a big success. And we've seen really high testing rates for COVID in amongst our health services. So we're taking the same approach and making sure that any Aboriginal health service that wants to deliver the vaccine, and nearly all of them do, have vaccine, both Pfizer and AstraZeneca in their fridge to give to the patient.
For sure. And now we'll take a look at a question coming in from Kylie.
If people do get some side effects from any of the vaccines, who can they tell and where can they report these side effects to?
It's really important that you tell people about the side effects you're experiencing, because we're keeping a close eye on side effects, and in particularly in side effects for Aboriginal and Torres Strait Islander people. There's a few ways that you can do it. Some people in the clinic, there's a little QR code and you can scan to do this online survey called Ausvac Safety. And what they'll do is they'll send you a text message at day 3 and day 8 after your vaccine asking about side effects. But if you've had anything that you are really concerned about, the best thing is to go back to your clinic and to talk to your doctor about it. And then they then report that to the TGA, who's monitoring vaccine safety overall in Australia.
I think that's really important. Don't be shame about it. Just give them a call as soon as you got those questions. And, while there isn't any shame involved, we've had a number of questions submitted anonymously as well. So I wanted to ask you, Dr. Jan, on behalf of someone, they say, are the vaccines safe? I feel uncomfortable because they've been developed so quickly and there might be stuff we don't know about them.
Look, and I think, it's a fair question to ask, but the key thing is that the vaccines are going through a full examination of their safety. There's constant data about how safe they are and if there's any groups we need to be particularly careful for. This is one of the most amazing feats of human endeavour. Never have so many people been immunised with the same vaccines at the same time across the world. So data that might have taken us 5 or 10 years to collect about the vaccine safety for very rare side effects, we're finding in a couple of months. And so when we find those side effects, we tell people about them. And that's what's given some confusion, I think, because we've been so careful to make sure that people know about the side effects. We haven't been emphasising the benefits enough. And even with something like a clot, if you get COVID, one of the side effects of having COVID is getting clots. And so if you're more likely to get clots because you've had surgery in the past or because you've had a clot before, it's really important that you get vaccinated because you're more likely to get a clot with COVID than you are with the vaccine. So it's much safer to have those vaccines than it is to have COVID if you're worried about clots, for example.
Yeah, it's good to have that kind of clarity and perspective on it, you know?
Yeah, and most of us wouldn't think twice about getting on a plane to go somewhere. And, you know, it's about a 1 in 6,000 risk of having a clot in your leg if you get on a plane and fly for more than 5 hours. Whereas more like a 1 in 100,000 risk of getting a clot from one of the vaccines. So if you're happy or would ever like to get on a plane and go somewhere overseas, you're far more likely to have a clot from that than you would be from the vaccine.
And Dr. Jan, someone asked, what's inside the vaccines? They say, I don't like the idea of putting metals and foreign stuff like microchips in my body. What do you say to that?
There's a lot of rumours going about what's in the vaccine. The thing is, every vaccine ingredient is up on the website. You can read them for yourself. There are no microchips. There is no 5G antenna. There are no bits of metal in these vaccines. They're incredibly safe. There's no mercury if people are putting that about. There's no antifreeze. They're very, very safe vaccines that have got things that we use to give any other medical treatment. And so it's really important that people go back to really good sources of truth, like their clinic that they trust, and talk to their GP rather than looking at Facebook groups, to be perfectly honest. I know this post might go on Facebook, so I'm almost contradicting myself, but social media is not the best way to find out about vaccines. There's some really good information, but if you're ever worried and you hear something like that, if you talk to your GP, they'll be able to help you.
And the next question I have here for Dr. Jason is that I've heard that Aboriginal people can't get COVID-19, so I don't need to get the vaccine. Is it true?
No, unfortunately, it's not true. Okay. And even though we've done really well with keeping COVID out of communities, still over 160 Aboriginal and Torres Strait Islander people have had COVID-19 since the start of the pandemic, including some famous Aboriginal and Torres Strait Islander people as well. I won't name them now, but so it definitely can occur, and that's why getting vaccinated is one of the big things that we're really pushing for the community members.
And it is so important to protect all of our people, but especially our old people who are the keepers of that knowledge as well.
Yeah, that's right. And you know, the thing is that the old people have been rolling up their sleeves and getting the vaccine. So if we look at the group over the age of 60, it's around 60 to 70% of that age group have already received at least one dose of the vaccine. So, you know, we're really looking to keep pushing that up, but also for younger people to roll up their sleeves and get the vaccine to help protect them as well.
Yeah, definitely start pulling our weight and doing what we can to support that vaccine rate. And another question I have about, you know, our communities that are remote and regional, what work's being done to make sure that they have access to the same supplies that many in the metropolitan areas might have?
Yeah, so there's a few things going on all across the country. So in some places where there's already an Aboriginal health service, we're delivering vaccine to them, you know, every week, both Pfizer and AstraZeneca, like we are any other clinic across the country. And there are other communities where they've said, look, I think what's going to be best is that if you come in and just do the whole community in one hit. And so we're starting to do that in a number of remote communities across the country. And we're often doing that with partnerships with the Royal Flying Doctors Service or the State Health Clinic wherever we are. So there's a whole bunch of different efforts going on to make sure that we get people in remote communities vaccinated as well.
A big shout out to all the health workers in our community controlled health centres and everyone else on the front line doing that work to make sure that there is access and culturally safe administrations are going on all around the country. But well, it looks like that is all we have time for today, but thank you so much for both of you taking the time to come on and answer a lot of the questions that many mob might have across the country. We really appreciate your time. And to everyone out there, if you have any other questions about COVID-19 vaccines that we didn't cover today, please reach out to your GP, Aboriginal Medical Service or Aboriginal health worker, or visit newsouthwales.gov.au. Thank you again for coming on, both of you, Dr. Jan, Dr. Jason, and we look forward to seeing you all at our next Yarn Up very soon.
Thanks for having us, Shani.